The health disparities for women, particularly Black women, have been great before COVID-19. This just made it worse. And so I find it to be prime opportunity for us to give this the type of focus that it has long deserved. My name is Asasiya Muhammad. I am a home birth midwife in Philadelphia. My practice is Inner Circle Midwifery. I've been practicing birth work for about 13 years. I've been a midwife professionally for 7.5 years. I am a child of immigrants. A lot of West Indian American children, our ambitions and our passion comes from our heritage. Jamaica has a strong history of resistance. Marcus Garvey and Bob Marley and J.A. Rogers and Nanny of the Maroon, who led a slave revolt. So I feel like that's in my blood, and it translates to what I do here on the state side. I have a really strong passion for my people. Systemic racism and discrimination exists across the board in our society, and it just has a trickle-down effect into communities where we have lack of access, and then in the hospitals and the medical system where oftentimes we're not seen as full humans. We see that a lot in other cases with our brothers, with the justice system and the police, but in a different way, it expresses itself with dehumanizing women, especially Black women. I would say that Inner Circle Midwifery we have positioned ourselves in Philadelphia to reach people who have otherwise been neglected by the larger system, and even by well-meaning midwives who just don't have the cultural sensitivity that is required to deal with this kind of experience. But we are open to all. We have a variety of families. We have families from all of different religions, races, backgrounds, sexual orientations who are part of our inner circle. That's what we call them. We're really trying to build our village. A lot of people are afraid, and the current situation for expecting mothers is that those who have planned to give birth in the hospital are, one, afraid of being exposed to COVID-19 just from being in the environment itself, and then two, a lot of hospitals have and states have made the regulations where you cannot have a support person. So, folks are having to be left in triage, and then they go up and they're laboring by themselves. So naturally, that's going to bring on a lot of fear and anxiety. I've been answering all calls. So even if I don't recognize the number, I answer all calls. But I wanted people to know that they could reach out in spite of, even if they don't want to have a home birth, that they can just talk to a professional about what their decisions and what their options are. Some folks have even made supply donations to us and 95 masks. Some folks have even made monetary donations to assist families who want to have home births who might not have the means to do so. You're not relinquishing your rights in this thing. You still have the right to dignified care. You still have a right to a labor companion, and you still have the right to express your concerns. This is a sacred time, and you still have the right to treat it as such.